Welcome back, everybody. Today our guest is Dr. Meghan Wintermyer. Meghan and I met each other not too long ago at a Grand Prix event in Middle Tennessee. Our Grand Prix, are you working on, those type of horses, jumping horses, as well as Western discipline horses?
Absolutely. Everything from dressage horses, Grand Prix horses, Tennessee walking horses, backyard pleasure horses, trail horses, you name it.
So pretty much any horse can benefit from acupuncture.
Absolutely.
Now what about, this was one question I had. I don't necessarily see anything really wrong with my horses. Would it be a good therapy or treatment for them, even if there's nothing necessarily specifically acutely wrong? Can it benefit any horse?
My response is that if I scanned your horse and I saw something wrong, I would tell you. And if I didn't see anything wrong, I wouldn't treat your horse.
Okay.
I might recommend possibly an herbal supplement to help him if I see that he is a non-sweater or something that you haven't possibly picked up on.
Okay.
But if there's nothing going on, it's not a therapy that I would just willy-nilly throw on every horse.
Okay.
Yes.
And so it does necessitate an overall scan of the horse. And you evaluate that horse before you start treating.
Before I treat my horses, I do first of all, is I ask the owner exactly what's been going on. Just as a conventional veterinarian, I want to know if the horse is still eating, how is he doing under saddle, everything your normal veterinarian would ask. And then I would look at its tongue, I would check its pulses, I would feel its back, I would get what's called Beyond Zheng in traditional Chinese veterinary medicine, which means pattern diagnosis. And then I would form my treatment plan.
Okay. So what exactly are you looking for when you examine their tongue?
So the tongue tells a lot. If, for example, if the tongue is purple and swollen, it's an indication of pain and stagnation. You can't see it here, but this horse's tongue is red because he is a yin deficient horse. Checking its pulses, and the pulse changes depending on if there is pain or if there is a deficiency in the animal. So it all goes back to trying to get the pattern diagnosis. And once we have the pattern diagnosis, we can balance the horse out through acupuncture and herbs.
Okay. And then you just, you start from head to tail, go
head
over
to tail,
everything.
Exactly. And now I'm starting my scan, and I just use a pen cap, and I first start where I'm trying to see what the horse's normal reaction is. And then I scan him, and you can see this horse is not reacting at all because I'm going over points, diagnostic points, that he's not painful on.
Okay.
But then pretty soon you're going to see that I'm going to go over a point. Oh, you see that right there? He reacted. But I would call that a 1 out of 5. And then I go back further along his back, and then he reacts even more.
So like flinching?
Flinching, they can vary from, I would say a 5 out of 5 is when the horse tries to bite me. So those were his hip points. He's letting me know that he feels that.
Okay.
A lot of horses that have back pains, they'll get the lordosis, or they'll sway their back. They'll move away from the pressure.
Okay.
Yes. And so basically I'm looking for any response, and where the response is, it tells me where the pain is. And just because the pain, so example, right underneath these TMJs, that could be he has chronic dental pain, and he's moving away from that pain. I know this horse very well. But it could also be a sign of ulcers, so I would take that into account and then move on to other spots that might show ulcers. And
so so the point where he reacts is not necessarily where the pain may be.
That's exactly, I'm glad you asked that. That's exactly right.
Okay, and that is obviously something you learned at school, is what points signal where the pain is.
Exactly. I'm really glad you asked that. Exactly.
Okay. And for the most part, is that the way it is, that one spot equals a pain in a different body part or area, or is it?
It depends.
Okay.
I love that answer. It depends, because you can have a horse that has chronic saddle or a saddle fit problem, and his entire back is palpating sore. Well, that's a saddle problem.
Yeah.
That doesn't mean that his lung and heart and kidney and everything else is infected. It just means he has bad saddle fit.
Okay.
On the other hand, you can have horses that are reacting in
Okay.
I'm sorry.
No, you're fine. You're good. Okay, so this is your first step, is to go over these horses, and especially a horse that you've not seen for the first time.
Exactly. I look at these horses this way every time.
Every time?
Yes.
Okay, just so, and then do you document and chart
Absolutely.
where that horse is hurting?
Absolutely.
Okay. And so what would your next step then be after scanning your horse?
I would plan my treatment plan, and then usually I would go with, first would be dry needle acupuncture, and it's not a typical needle. It is not hollow, it's blunt, and I would insert in specific areas to give the horse, give me permission to let me continue the acupuncture process. And then depending on what problem the horse had, then I would move on with the acupuncture.
How does the horse typically react to you coming in, first palpating them or scanning them? Are they wary of it? Do they show any signs of that?
Part of the whole traditional Chinese veterinary medicine is horses' personality. And just like humans, horses have different personalities. So depending on the horse's personality and depending on, for example, the horse with a really big leg. He was so depressed and weak, he did not care how many needles I stuck in him the first couple times. But once he got his energy back and his normal personality, he was a fire, by the way. He let me know by moving away and swatting as if he was swatting at flies. But generally, the needles are so small, they don't even feel them go in.
Really?
Yes.
Okay. So how do you know where to start and place your needles?
By going to school.
By learning.
Yes.
Okay.
So you have to come up with a plan, and you want to balance the horse. So I'm going to, if I have, just for example, a horse with back pain, I'm going to treat locally. Then I'm going to treat influential points, which means points that influence the back but that aren't necessarily on the back.
Okay.
And then I want to balance the horse out by having points on the back and the front end.
Okay. And those are all dictated by meridians, correct?
Yes, and the meridians, the best way to describe it, there's 14 of them, 12 paired, and they're like the interstate system. So if I said bladder 28, well, it's actually part of 840 that runs along Nashville.
Okay.
And so it goes from the eye to the hind end. And if you have blockage on 840 and you want to clear it, you can put a point in it near his eye or his hind foot, and it'll clear that blockage.
Okay. And are those meridians the same on every horse?
Yes.
You know where they are?
Yes.
Okay. Just because you know?
Just because I had to learn them. And when I say that the meridians are the same on every horse, but like I said, there are ashi points, which are the trigger points, so those could be different on different horses. But the meridians, yes, they are all the same on all horses.
Okay.
Miniature horses, draft horses.
Okay. And then when you say blockage, now I know a lot of this that we're talking about acupuncture is really hard to fully explain.
Right.
Is it a blockage of energy, a blockage of feeling? I mean, what is that blocking?
So my best way to describe it is you can have a deficiency that's a blockage. So if you have a car driving on the highway and it's a 70-year-old man in a 7-year-old car and he's going really slow and everyone behind him wants to go faster so they feel that pain, so that blockage, as soon as you remove that 7-year-old man, the energy is able to flow.
Okay. And hopefully relieve pain.
And hopefully relieve
at
pain.
A site.
Exactly.
Okay. Now, let's see. So we've decided that our horse is in pain. We've decided that acupuncture may be the best therapy. So let's actually watch you doing it and tell us what you're doing in this video.
Okay. So this is the permission point. This is by way. This is just letting me, oh, here we are on different points, but I'm just putting the needles in.
Okay.
And you see me tap them in, and that's just, the horse's skin usually doesn't mind, but if you put some pressure before you put the needles in, the horse doesn't react at all. So I'm putting the needles in specific acupuncture points. Those just to stimulate the stomach. This horse has chronic GI issues, and you can see that I'm finding the points because there are anatomical locations where the acupuncture points are located. So I'm tapping it in, and then I'm just slowly inserting the acupuncture point. And you can see this horse actually had no one holding its head. Okay. He's just standing there, and here I am. He had blockage along his bladder channel, so like I was saying, I'm just putting a needle in.
And that, is that like kind of...
It's the medial canthus of his eye. It's not going anywhere near his eyeball.
Okay. Just under the skin?
Just underneath the skin.
Okay.
And this is a great point for inflammation. And like I said, don't do this at home unless you know what you're doing, because there are very important anatomical tendons, ligaments, arteries, and veins located right there.
You bet.
This is a horse that has equine metabolic syndrome and has the typical crusty neck, and acupuncture can be used to decrease the size of the neck. And we were just inserting the needles in specific spots along the neck, and so I could hook up the electrodes to stimulate the fat to be.
Huh. And so how long typically do needles stay in?
20 to 30 minutes, and I usually hook up the electroacupuncture units for 15 minutes. But like I said, it all depends on the disease. Those are points used just for chronic heel pain, if you saw those.
And that's something you see a lot of?
See a lot of, yes.
Okay, so you have inserted the needles in there. Do you see a horse react or relax?
The horse usually relax. They start licking their lips. They will yawn. That is, I love it when they'll drop their head and they'll yawn like 15 times, or they'll go to sleep. And when I hook up the electroacupuncture unit, I know when it's over because the horse will be asleep, and then all of a sudden perk up, ears will go up, and you go, okay, we know it's over, so we'll take the needles out.
All right. And so explain a little bit more how you know which of the types of acupuncture to use then.
It depends on the condition. So electroacupuncture is great for musculoskeletal pain, and there's different frequencies that you can set the unit at. 20 hertz is beta endorphin release, and that's really good for pain management. If it was an internal medicine case, say diarrhea, you would turn up the frequency to 200 hertz. So many things. I hate to keep saying it, but it depends on what the condition is.
Okay. Were you able to learn how to read the horse like that in school, or is it just experience that teaches you?
It's both. I mean, it's kind of like even vet school. You come out of vet school and you probably have more knowledge in your brain than you ever will.
Yeah.
But it's not until you get out there and do it and you see the response till you really know, okay, this is what the horse is doing, this is how he reacted, this is what I have to do next time.
Okay.
Yeah.
Are people really aware of acupuncture, or do you feel like it's growing in popularity?
I definitely think it's growing in popularity. Just in my class alone, I want to say there was over 130 veterinarians from, like I said, around the world and the United States. Within the central Tennessee area, I know there's veterinarians who specifically work on small animals and large animals. So the best clients are the ones who've had acupuncture themselves. I've had it on myself. I highly recommend it.
Because so much of it is hard to explain. So if you feel it yourself, then you can understand what your horse is feeling?
Exactly.
Okay. Well, I guess a lot of us are going to have to go get acupuncture. But you wouldn't necessarily go get acupuncture unless there was something wrong.
Exactly.
Okay. So hopefully you don't need acupuncture. But if you do, then you can experience it and kind of better understand what your horse is feeling.
Right.
And a lot of times it's best in conjunction with some other treatments that you're using for your horse.
Absolutely, 100%. There are very few times where I will only use acupuncture.
Okay.
Most of the time I'm using my Western conventional veterinary medicine in conjunction with acupuncture.
Okay.
And those two modalities together are what's best for the horse.
Okay. All right. Well, we're going to take a quick break, but Megan is going to stick around and we're going to continue our discussion on equine acupuncture. So we'll be right back after this.